Sorry, guys. Good morning, everyone. Welcome. Thank you for being here. All right, can everyone see the welcome screen? And for some head nodding, great, thank you. All right, you will have to forgive me today. I am short a team member, so I am going to be doing multiple roles today, and we are going to do our best. So welcome today. My name is Tiffany Domikos. I'm the Case Management Redesign Policy Advisor. And I'm going to hand the mic over to John Barry, and he's going to do some housekeeping for us.
Thank you, Tiffany. Good morning, everyone. This is John Barry with the Department of Healthcare Policy and Financing. We are on slide 2 of the deck. So just to say that we are recording this meeting, excuse me, as we have done in the past. We ask you to be mindful about the protected health information issue and to be mindful about what you're sharing. You certainly have choices here, but we're asking that you keep that in mind. If you have not seen it already, there should be a little pop-up box that asks you to acknowledge that you are in a recorded meeting. We are going to be using the chat in a little different way today because we're short-handed due to staff illness. So we will be taking and attempting to respond to comments through the speakers queue. If you want to use the chat, we will record those comments and questions and put them into the listening log as we've done, but we don't have the capacity today to be responding to things in the chat in that fashion. There is a link on the upper right of the screen for getting the slides. If you want to do that, you can download them. You can look at them live, although we will be showing them on the screen. If you're listening by phone, please press 6 to unmute your line when you are in the speaker's queue and you're due to speak, or you can press *9 and that will activate raising your hand in the webinar. So if it's at all possible for you to use *9 to raise your hand, that's how I'll be keeping track of people for the queue. I will at times be asking people to unmute using *6 if they need to give me your name. There is closed captioning available. Just click the link. It's on the lower center of the screen. And meeting information, as always, is on the Case Management Redesign website page, and that link is on the lower right. Next slide, please. So we're recording the meeting. Just again, just really wanting to stress that please be aware of the information that you are sharing. Please go to the next slide, please. And if we need to, we are going to call a time limit. It looks like a smaller crowd than we've had before. The reason for the time limit is so that we can make sure we have enough time for everyone to speak. So we're going to be doing that. I'll be invoking that as we need to. Again, comments in the chat are going to be strictly for the record at this point. You can type your name or comment in the chat. Next slide, please. So we do have a 2-minute time limit, and we will stick to that as we need to. We're going to be adding all ideas to the listening logs. If we're running out of time for comments for a particular portion of the meeting, you can always place your question or idea in the chat. It will be added to the listening log. Anything that is unrelated to the rule topic, we will add to a log, which we've been calling issues for further discussion. And so next slide, please. So here is today's agenda. Tiffany will be doing her usual great job of keeping us on track with that time-wise. And so thank you, Tiffany, for that. And we will now move into the rest of the meeting. So Tiffany?
All right, thanks for being here, everyone. So as most of you know who have been here with us before, the purpose of today's meeting is to share our draft rules for case management redesign and the restructure of our rules with members and family members and other stakeholders to gather feedback and input. Currently, our rule structure is fairly fragmented. We have kind of bits and pieces all over our rules. And so our intention is to create a new rule structure that is cohesive, that flows in a manner that is easy to follow, that is easy to understand with what the requirements are and who's responsible for what. So here you can see our proposed new rule structure. It starts with waiver and program overall rule and requirements and moves to case management agency requirements, then community center board requirements, and then finally service definitions and provider requirements. The goals for these updates are really just to look through all the rules and minimize the duplication we see, making sure that we have some consistency across the rules and across programs, and make sure that everyone involved really understands their roles and responsibilities. And then lastly, as I've mentioned before, a rule structure that is easy to follow and easy, at least easier to understand. So I want to chat just a little bit about and comment on the difference between restructure versus changes. So restructure is really moving rules around to be in a more accessible and understandable format and cleaning up language that is outdated, that doesn't reflect our current practices or policies. And again, making it into that format that is really cohesive and understandable. Changes are a little bit different, and we do have some changes in case management rule because of case management redesign. And so those two different types of feedback that we're asking for, one mostly is in the restructure. Does moving these rules in this format make sense? And then there are a few spaces where we are making changes, where we do need input from our stakeholders about those changes. We've mentioned before that these meetings are really just are mostly to focus on that restructure, and that changes to policy and kind of fleshing out all of those pieces. A lot of that policy work is happening outside of these meetings. So we've had a couple of topics come up in the last several meetings that we've had that we have said, you know what, that is a really important issue, but we don't have time or space or capacity in this meeting to address all of those questions. And so we're going to create a different space for that. We also have a lot of stakeholder work going on right now in the department, as I'm sure you're aware. And so we also have some ongoing meetings of stakeholder engagement and the policy changes that are happening to talk about and flesh out some of your questions there. So if those types of things come up, we have a log that we can put those in, and I will address that in just a second. So for today's meeting, we want to clarify roles and responsibilities. So I'm Tiffany. Nicolette is my teammate who is out sick today. And then we have John Barry. We are with the Department of Healthcare Policy and Financing. Our responsibilities really include walking through the rules, timekeeping, monitoring questions in the queue, and kind of overall flow of the meeting and directing questions to subject matter experts. We also have some department subject matter experts on the call. If you are with the department here as a subject matter expert, could you just raise your hand and people can see your names and maybe put your name in the chat and what your role is. So I see Kidron's hand raised, Leah, I know we have a couple more, but you'll see department staff coming in and answering some of the questions and concerns that come up as they relate to the rule updates. They will help support with kind of directing us in where other work is happening and how your question can be addressed. And then lastly, we have HCBS Strategies, which is our contractor, who they are doing a lot of the behind the scenes. They are record keeping. They are keeping track of our listening logs and issues for further discussion, making sure we're completing that follow-up, helping develop the language for the rules that is consistent, making sure that there's consistency across the rules, and then again assisting with time management and the follow-up question management. So those are our roles and responsibilities. We do have these 2 logs, which you can find on our website. And I'm wondering if we can get those in the chat so people can see them. These are updated as we are going. So you will notice today that I think there are approximately 106 questions or comments. And by the end of today's meeting, we will have all of the questions and comments from today added to those meetings. So Steve and his team are adding those as they come up, and that goes onto our website live. Steve, did you want to show those?
To show the changes?
Mm-hmm.
We can. Yeah, I can show those quickly. Okay, so this is the listening log in which we enter the information. And if you go and review that, you'll see that all of the ones from the previous meetings are there and that many of them have been resolved and accepted. So there have been changes that are continually happening on that. And then there's the issues for further discussions one on it, in which there also has been progress in identifying the additional meetings and tying it to other meetings that are occurring. So these have been very actively used documents.
Great, thank you. All right. So for today we are going to be talking, we're going to do a little bit of a break. The benefits and services team asked to have some of our time today to talk about their restructuring of their rules and wanted to get some feedback. So they will start us off with that. And then we're going to be talking about member and individual rights, member and individual responsibilities, and rights modifications. So for the services structure, one of the goals is to really expand provider capacity and waiver services and make it easier for providers to expand to other services. And expanding access to services really means that it makes it easier for providers to figure out how to serve more populations. So that will be the input that team is looking for. And actually, why don't we just pause, and while we're talking about this, do we want to just do this right now, Cassie?
Yeah, absolutely. All right. Well, good morning, everyone. My name is Cassandra Keller, and I'm our Community Options Benefits Section Manager. And what that means is my teams oversee all of our home and community-based services. We are working on how to restructure these rules in regards to the services. And so when I'm talking about the services, we're looking at what is the definition of the service, what are the limitations, what are the allowances of the service, what are the provider requirements. And so what we took, one of the hardest ones that we think is out there is adult respite. In every single adult waiver, for some reason, respite is just a little bit different. And so we have five waivers that we have, what respite means and what those service definition is and what those unit limitations are. So what we have done is created 2 templates, and I think this got sent out ahead of time through email distribution, but we will share it again so you can take a look at this. But what we have done is said, okay, let's try template 1, and this takes the service by section and not waiver. And so you will see under inclusions, this is going to include the elderly, blind, and disabled, the community and or complementary and integrative health waiver, and the community mental health supports waiver in one. And then brain injury and supported living services will be separate. But what we would have are all together when speaking about those waivers, we would talk about what are the inclusions and then what are the exclusions. And so we would be speaking of those services together. If you want to go down just a little bit more. So because those are a little bit different, brain injury and supported living services, those are going to be separated out in and of themselves. So sorry, I know this all feels very confusing, though. We will share this document. So then here's the section of here's what all the provider reimbursement requirements are. And again, speaking for all of these waivers within this one section. If you would scroll down, Tiffany, to template 2, we have a different way. We've said, okay, let's forget about trying to lump them together for liked topics. Let's do it for each waiver. And so we would have the service for every respite for elderly, blind, and disabled, the CIH waiver, the CMHS waiver. So it would be for each waiver, it would talk about all of those components in its own section. So that's kind of how we have formatted it. There's 2 options, and obviously there can be other options if folks can come up with something else creative. But those are the 2 ways we are kind of looking at it. We certainly see that there are pros and cons to each way. I don't think either one is really perfect, but we're trying to figure out what would be easier as a provider, a member, consumer. What would be easier to navigate? Would it be to go, I want to know what I have to do to be a provider or as a member for SLS respite and go straight to that? Or would it be, I want to know what the provider reimbursement requirements are, and I would know it for all of the waivers. So that's kind of what we're trying to do. Kira is going to drop in a link. We've created a Survey Monkey, so you could let us know your thoughts on which one seems more palatable. Again, I think it's going to be a lot of overwhelming information either way we do this. And respite, again, is going to be one of the most complicated ones. You know, if we're looking at alternative care facilities, it's exactly the same for the elderly, blind, and disabled and the community mental health supports waiver. So services like that are going to be really simple, and we won't have all of these different pieces. But when you're looking at respite and some of these other services where there's just a slight difference between them, they're different enough that we can't say this is the same for all of them. So we will make sure to, I think I can drop a PDF in here. I have these rules, these templates in a PDF, and I can put them in here. So take a look, kind of see what you think is your preference. There's an option to put other, again, if you have something creative as a way, there might be a way to kind of hybrid and do both options of service and waiver or component and waiver. So again, we just want to know before we go and do all of the work to move these things around, we want to know what you think would be preferable and how to find things. Are there any questions? I'm seeing none in the chat. Yeah, definitely, Jen. We have, we do want to address, and that's one of the things that we plan to do is as much as possible during this process of if there are if there are some differences in the waivers that we can address in terms of provider requirements, things that are not budget positive, we're definitely looking at and trying to align that. Now, some of the things for respite, it would cause a budget implication, and so it would be cost positive. So we may not be able to address those type of changes in terms of what service or unit limits are, for example, but we're definitely looking at, let's take massage therapy. If there is just a small difference in what provider requirements are for this children's extensive support waiver and the complementary and integrative health waiver, we definitely want to try and align those so that we can say, this is what the requirements are to be a provider of massage across the board. We don't want to see those differences in terms of waiver. Any other questions? Okay. Well, we are going to also send this information out through John Barry's email blast. So we will have it, you might see it there, but then I will, before I hop off, I will make sure to drop in the PDF version of these rules so you can digest them, because I know I threw a lot at you. So thank you everybody for taking the time to kind of see our plans and sharing your feedback on what your preferences are.
All right, thanks, Cassie. All right, we've got that off our agenda for today, and we will let Cassie loose for this meeting. So we want to start today. We're talking about member and individual rights, and we want to do a little bit of background and kind of laying the foundation. Most of you, I would say almost all of you, are very well versed in member rights. Because this is being recorded, we just want to set some foundation on, you know, what are member rights? Where does this language even come from? What are we going to be talking about today before we actually get into the rules? So I'm going to hand it over to my colleague Leah, and she is going to walk us through these pieces.
Thanks, Tiffany. So as Tiffany mentioned, what I am hoping to do today is just provide an introduction and on the understanding that what I'm talking about today is a little more than you actually need to know today just to look at the changes that are on deck for today. I'm trying to really set the table for today, but also following days. So there is rule language and there will be revisions that we'll go over today, but also that we'll be reviewing in later meetings. So you'll have a chance to digest what's in this slide deck for later meetings too. So what the diagram on this slide shows is basically that first of all, as a starting point, we all have the same rights. So people receiving services at a minimum have the same rights as anyone else. Even getting to that point, as you all know, has been sort of a historical process to even get to that starting point. But everyone, whether it's you, me, people we serve, we all have human rights, we have civil rights. So those are things that you may look to in the Constitution, in statute, and so forth. Then, in addition, people who receive home and community-based services, which we call HCBS, have additional rights because they receive those services. So those are supplementing the basic rights that we all have. And so just some examples of those kinds of rights are the right to be informed of their rights, the right to speak with and be visited by a long-term care ombudsman or other advocates, depending on the setting type, the right to access dispute resolution and complaint or grievance procedures, and rights that are protected by the HCBS settings final rule. And I am going to dive into that on the next slide. Tiffany, if we can move along. Okay, so this is a wall of text, and I am not going to go through this in detail right now. And I encourage you to take a copy of the slides and download them and review it at your leisure. But these are some rights that people have under the federal HCBS settings final rule. And the gist of that rule is setting out or detailing the rights that people have when they live or receive services in a setting where HCBS are provided. So I am not going to read this whole long list, and don't worry about trying to read it all right now. I will preview for you for later meetings that we codified this federal rule in what's currently part of our rules at 8.484. And that will be coming up in the rules that we will be reviewing in the coming weeks and months, mostly when we get to the provider rules. The only thing I want to stress for today is just that these rights are the same for all individuals receiving services, all waivers, all populations. This rule does not differentiate between folks with intellectual and developmental disabilities and other disabilities. It's not different for adults and kids, although the way it applies there are some wrinkles with kids, but as a starting point, this is for everybody. Next slide. So one thing that the federal rule does is it sets out a process for modifying rights at HCBS settings in individual cases. So a number of criteria have to be documented, and I didn't list them all here, but examples are that there's an individualized assessed need for the modification. So it's really specific to this individual. You have to document what less restrictive measures were tried that failed. And you have to get the informed consent of the individual to the rights modification. And there's more not detailed here. So if the individual has a guardian or another legally authorized representative with the ability to make this decision on their behalf, then it could be that you're getting the informed consent of that person rather than the member actually receiving services. And again, just like on the last slide, this rights modification process is the same for everyone, all waivers, all populations. Next slide. This is a slide. If you can't look at it, it's a sort of a bubble diagram or a Venn diagram with a big circle called rights modifications under the federal rule. And then there's a bunch of smaller circles inside it. And the point of this is to show that if any kind of measure, if it restricts an individual from fully exercising any of their rights, it is a rights modification. It fits within that federal term of a rights modification. So the examples that I included in sort of interior circles would be right suspensions, which that particular term I think is familiar to folks who work with community-centered boards and those who receive or provide services under the DD, SLS, and CES waivers. But some of the circles that we'll talk about in a moment are not specific to any particular waiver. So rights suspensions do fall within the rights modification concept. Other examples, restrictive procedures. Again, that's familiar to folks on some waivers and not others. Emergency control procedures and safety control procedures are also familiar to some waivers and not others. And then some of these concepts are really known across the board. Restraints is an example. Restraint and emergency control procedure, safety control procedure have some overlap. I didn't attempt to make the interior circles as detailed as they might need to be, but restraints, those circles overlap, but the word restraints or that term is maybe more familiar to people in certain waivers. Any kind of house rule or any kind of policy or procedure that a provider has that restricts rights, even if it doesn't have a formal name like right suspension, is a rights modification. And then lastly, I'll just flag that all of these measures, and there's more, you could call them whatever you want to call them, whenever they're limiting individual rights, they're going to be rolled up into that federal concept of a rights modification. Next slide, and I think that this is my last one, is sort of having set the table there for the next several meetings. What are we going to talk about today? So you will see provisions that basically just adding some language within the rules for case management agencies and for case managers that sort of reiterate and clarify their role in the rights modification process as distinct from the provider's role, which is covered in other sections of rule that are, again, currently in 8.484, but will be landing in those later sections of rules that we haven't gotten to yet. There are some changes today that update language from old terms to new terms. So like if the phrase rights suspension appears somewhere, it's being updated to rights modification. And then we are proposing to strike language that's either inconsistent with 8.484 or redundant with our codification of the federal rule. So examples of that. One example is to eliminate notice for rights suspensions. Providing notice for something that actually requires the individual's informed consent can be unnecessary and confusing. And while that notice provision has stayed in place under current rule for a long time, we've always promised that the sort of long run result is we'll be getting rid of notice because there's now a more robust process for getting consent. Another example of changes, these are things we propose to strike that are, they're not inconsistent with 8.484, they're just redundant. We have statements of member rights, we have provisions for emergency right suspensions that are really addressed more comprehensively and using more modern terminology in our version of the federal rule. So to reiterate that last point, where we are proposing to strike certain statements of member rights, it is not because we don't think members should have those rights or do have those rights. It's just because we're trying not to say the same thing or sort of close to the same thing in 2 different places or sometimes 3 or 4 different places. We're just trying to streamline the rules. And when you have a lot of sort of near restatements of the same thing, it can be confusing at best. So some of the strikes that you'll see today are simply because we think 8.484 does the job for everyone. And with that, I think I will pass it back to Tiffany.
Thanks, Leah. So some other changes to spot today, you'll see SEP and CCB language change to CMA or Case Management Agency. You'll also notice the use of member, individual, and client. So at the department, member is a Medicaid recipient. An individual is any non-Medicaid recipient. And a client is an individual applying for services or Medicaid. So that will be clarified in our definitions section, but I wanted to clarify that for you all in case there was confusion. And then last, like Leah mentioned, there are some redundant items that are struck out and that reference some other areas. So today, really input needed from you all is, does the flow of information make sense? Are there rights and responsibilities that for clients, members, and individuals that you would like added, removed, changed, maybe put in a different place, all of that kind of thing? And then is there more plain language that we can use in this section? As we've mentioned previously, we are working towards having more plain language in our rules so that members can understand that. And we do have some plain language contractors that we're working with to support that. That will be kind of the final review will be that update for plain language, but we are happy to take input about that at today's meeting. Any questions about what we're going to be reviewing today?
So this is John Barry. Thank you, Tiffany. As I mentioned before, because of staff shortage due to illness, we're not completely using the chat the way we have in the past. So if you want to have a question or comment responded to during this meeting, please use the speakers queue. You can type your name in the chat right now, or you can go to the reactions button in the webinar, click raise hand, and that will signal us that you are in the queue. It looks like there's a couple of people who might be on the phone only. So if you are on the phone only, you can certainly unmute right now and give me your name by pressing *6 if you want to be in the queue. Any of those three methods. So I'm looking in the chat for any names. Seeing if anyone unmutes right now to give me your name or hands raised in the webinar. Okay, Tiffany, so far I'm seeing none, hearing none.
All right, then we will move forward with reviewing our rules. So can everyone see the rule document I'm sharing? Somebody nod ahead. Yes. Okay, great. Thank you. So you can see our key at the top is anything in blue with backslashes is a major revision. I don't believe we have any blue in this section. In green with the kind of fancy brackets is something that has been moved or updated, that is some similar language that's been changed just a tiny bit. In red with the hard brackets is an outdated reference, something that is to be updated. And then the hard brackets in red and crossed through is an outdated reference and something that will be removed. And then last is additional review in grayed out bold. So those are the kind of indicators that you'll see today. So we will walk through this kind of section by section, and then we will pause and take questions, comments, or feedback at the end of each section. So first is member and individual rights and responsibilities. That is the title for this entire section. You will also notice, I guess I should mention, that we have a numbering system, and it is 8.7000 is where all of these rules will live, including waiver rules and case management and providers and services. And so we are attempting to use that numbering system here so that we can get used to it, so that you all can get used to it. So this is our attempt at that. Let us know how it goes. So overall, in 8.7210 is our member and individual rights and responsibilities. In point 1 of that section is member rights. So the first one is a person receiving services has the same legal rights and responsibilities guaranteed to all other individuals under the federal and state constitutions and federal and state laws, including but not limited to those contained in statute. And the reference is section 25.5-10, unless such rights are modified pursuant to state or federal law. Letter B is many member rights, and a process for modifying those rights in individual cases are set forth in 8.484. Members have additional rights as set forth below and elsewhere in these rules. Letters C and D, you'll see, are in red.
Margaret. Hey.
Oh.
Are you
Have a
done?
question? Someone have a question?
The meeting went well.
Excuse me, someone is on the line and is not muted. There we go. All right, so you'll see in letters C and D that we have taken out the every client has the right to the same consideration and treatment as anyone else, regardless of race, et cetera, et cetera. I believe that this is because that is in 8.484. We've already made that reference. And so again, not wanting to duplicate that, we are going to put in that reference, have that piece fleshed out in 8.484. Letter E is no client, his or her family member, guardian, or client representative may be retaliated against in their receipt of case management services or supports as a result of attempts to advocate on their own behalf. And letter F, each client receiving services has the right to read or have explained in each client's and family's native language any policies and or procedures adopted by the case management agency. And case management agency is in green with the fancy bracket, meaning that it is, it was probably single entry point or CCB language and has been changed to case management agency. I will pause there and ask John to open up the queue.
Thank you, Tiffany. And I have one name in the queue so far, and we'll get to you, Mary Michael. Anyone else, you can type your name in the chat. You can raise your hand in the webinar. And if there's anyone who's on the phone only, you can unmute your phone and give me your name right now. I'm looking for other names in the chat. Jose, thank you. Have your name down. Okay, we'll start the queue. And again, if you want to put your name in, that's fine. Mary Michael, please go ahead.
Thank you. My question is, I've noticed that repeatedly when we need to report a violation of any of these rights, that reporting often goes to the same person or organization who is doing the violating. Has any thought been given to creating some sort of advocacy or rights or protections actually within HCPF to look out for the client's rights?
Yeah, that's a great question. I don't know that I'm prepared to speak to that. I know we have a couple of case management folks. You're talking about grievances against the case management agencies specifically?
Yes, exactly. Either against case management or even against their supervisors.
Okay. Yeah, so we are building into case management rules the requirement for a grievance process. We will also have a community advisory group that will be required for case management agencies, but the membership will not be case management staff. That will specifically be for reviewing and taking a look at all of the grievances. We also do have escalation protocols. So I know that Kidron is on here somewhere. I don't know if she wants to jump on and answer that question real quick.
Yeah, thank you, Tiffany. This is Kidron Backus. I'm the case management supervisor at the department. What Tiffany said is absolutely accurate. We currently have in contract requirements for case management agencies to have a dispute resolution, complaint, and grievance process, and currently have a way for folks to escalate things to the department and our staff within our case management quality performance team if those complaints and grievances are not resolved at the case management agency level. If somebody can pop in our case management agency complaint form in the chat, we can certainly provide that to this group today. That's our current system now. And then in the future, building out our requirements, contractual requirements for case management agencies within those complaint, grievance, dispute processes. Those will still exist at the case management agency level, and then adding in that community group at each case management agency to be reviewing those complaints is our future plan at a high level. So hopefully that answered your question.
Actually, I was going to say that that's insufficient because the current ways that we can access those grievances aren't accessible to many of the people who would need to file a grievance. For example, someone might need help filling out paperwork. Someone might need to be able to call in and say, could you look into this? It doesn't sound, this doesn't seem right. But instead, right now, the grievance process seems to be included within the case management agency itself. And so having someone supervise their own problems is problematic.
Thanks
So
for that. Go ahead,
I was,
Kidron.
I was just going to say thank you for that feedback. I think that that's something that we wouldn't be prepared to directly speak to today, but we appreciate that feedback, and we're able to take that in consideration as we build out our contractual requirements in the future and look at current practices. So thank you very much.
Okay, thank you. Jose Torres, you're up next.
Thank you, John. I noticed when I was reviewing this document that you're presenting, Tiffany, the strike on C&D, and I get what you're saying, that it's repetitive because we have it somewhere else as well. I guess my question is this: is that section going to be within the same document? Because one thing I noticed through my years of working with legislative work and Medicaid rules is that if it is not stated in the document over and over and over in the different documents that are part of the sections, it is not often respected. And this is why it has been, as a legal practice, be present in every one of the dockets, if you will. So I guess if it is going to be within the same document, it's fine. But I think that if we are going to separate the different dockets of the section 8.484, etc., we need to keep those rights in place.
Great. Thanks for that feedback and suggestion. We will take that back to the team and talk through how we can incorporate that. Thank you.
Thank you, Jose. Christy Broughton, you're up next.
Good morning, thanks. I was curious specifically about whether the department continues to have rules at 8.484. I thought the intent was to simplify, and so it looks like we're establishing another section of rule to address rights here, and still reference a second one that has a substantial amount of member rights information. And so I guess I'm hoping, I was hoping that what we were going to be looking at was a document that contained all of the member rights and not some of the rights with references to some of the other right locations.
Okay, so Christy, what I'm hearing from you is that you would like to suggest that all member rights are in this one section, and that this is the section that gets referenced to?
Correct. Yes, absolutely.
Okay, thank you for that feedback. Yeah, 8.484, Leah, please correct me if I'm wrong, is intended to be incorporated in this rule restructure. And I'm not exactly sure where it is supposed to land. So we've kept that reference just to make sure that we know where that is and what needs to be moved. But yeah, I appreciate that comment and that feedback. Leah, do you have anything else you want to mention about this?
No, so, and this response will go back to what Jose was saying as well. I mean, in terms of where 8.484 will land, it will be somewhere in this new, I guess, 8.7,000 chapter. I'm not sure at what level you'd call different subsections, different documents, but it will be in this 8.7,000 new final product. My understanding is that most of what's currently in 8.484, we saw all the, we included all the definitions in an earlier section that was maybe one of the first sections this group looked at, but the bulk of 8.484, where it says like what a setting has to look like and what a setting has to ensure in terms of member rights, I believe is still coming up in what will be the provider or service rules.
Sure.
But
Okay.
I hear what you're saying, and what Christy, what you're saying about like why are some rights here and some rights there. And I would, I guess, defer to Tiffany on the point that I think we're still thinking through it, and we'll take that back.
Okay, great. Because yeah, there's 8.484 that has some member rights there, and then there's a whole section on suspension of rights and rights modifications, and I thought the intent was to really combine them all. And so that's my hope, is that members and providers only have to go to one section. And so we know, the 8.7210.4 member rights modifications covers the entire volume of what we all need to know in order to put a rights modification in place or not.
Yep.
And then I
Gotcha.
had two more just sort of style questions / comments. I'm wondering if there's a way, or if the department has thought about adopting gender neutral language. And so we look here under member rights 8.7210.1E, and it says his, her family members. Is that something that the department is planning to address? And then,
great question. I don't know that I have the answer to that question, but I think that's a great suggestion for us to consider, and we can take that back to our leadership and communications teams. So yeah.
okay. And then one last one real quick. Consistency in the use of person or individual. And I'm sure that's a much bigger beast than it appears on paper, but if the department could adopt kind of a moving forward, we use one or the other rather than both, I think it would just help the absorption rate when we're reading the rules.
Yep. Okay, that sounds great. Happy to look at that. Thanks, Christy. Any other questions, comments, feedback about this section? Are there things that are missing that you would like to propose?
So this is John again. We're looking for names for the queue in response to Tiffany's question. You can type your name in the chat, raise your hand in the webinar, or if you're on the phone only, you can unmute and give me your name right now. See a couple of folks, thanks, we'll get to you. Hearing no people unmuting, let's start with Amanda.
Hello. So my question revolves around where it says F in the family's native language, policies and procedures. Is there a push for the department to include additional languages so that we have that available to them, such as the DD determination application? I know we currently only have an English and Spanish. We have several non-English Spanish speaking families in our area, and obtaining the appropriate paperwork has proven difficult. So I was just wondering if there was any discussion around that.
Yeah, that's a great question. I know that this is a priority for the department to have materials for members in their native language or the language of their choosing. So I can, I'm not sure how much this has been fleshed out on, who's responsible for providing that, but happy to ask the question to the team responsible for that, and to put that in the logs and get an answer for you.
Thank you.
Mm-hmm.
Thanks, this is John again. There was a second person with their hand raised. Looks like you lowered it. If that was unintentional, you can raise your hand again. Any other names for the queue? Okay, Alicia, thanks. You did mean to lower your hand. Fine. Tiffany, seeing nothing else, hearing nothing else for right now.
Sounds good. We will move on to 8.7210.2, which is member responsibilities. The letter A, each client, member, or guardian is responsible to 1, provide accurate information regarding the client's or member's ability to complete activities of daily living. 2, assist in promoting the client's or member's independence. 3, cooperate in the determination of financial eligibility for Medicaid. 4, notify the case manager within 30 days after changes in the client's or member's support system, medical, physical, or psychological condition or living situation, including any hospitalizations, emergency room admissions, placement to a nursing home, or ICF-IID. B, the member has not received an HCBS waiver service during 1 month. C, changes in the member's care needs. D, problems with receiving HCBS waiver services. And E, changes that may affect Medicaid financial eligibility, including prompt reporting of changes in income or asset. And I will pause there for feedback on and questions regarding member responsibilities.
Thanks, Tiffany. This is John. So again, we're collecting names for the queue. We have your name down, Mary Michael. Thank you. Be with you. Anyone else? I'm looking in the chat, seeing if there's hands raised. Julie, we have your name. Thank you. If there's anyone who needs to unmute their phone to give me their name, you can do it now. Press *6. Or you can press *9 on your phone to raise your hand as well. Okay. Let's start with Mary Michael. Please go ahead.
Thank you. Once again, I need to point out that if the case manager or if the single point entry system does not respond to these, the client has no recourse. For example, there was a time when I literally reached out for about 8 months asking for an increase in services, and even had medical professionals reach out and did not receive those services. So while it's great that you have that you'll be having an outside entity reviewing, requests, the urgency with which the clients need the services is not reflected in these documents.
Thanks for that, Mary. I'm wondering if we can take that back to the team and talk through, or ask you, when we're talking about responsibilities, so if there was a reference to their right to a, client right to a grievance process and escalation protocols, would that meet the need in this section also? Or are you suggesting something else?
I think that would be helpful, but it needs to be structured in such a way that those handling the grievance process are not the same as those being grieved.
Sure.
And it has to be handled in such a way that the limitations of the clients are taken into account. For example, many of us may not have the energy to do much more than make a phone call or say, here are the emails. Some of the investigation needs to be supported by someone else. Mm-hmm. Otherwise, it becomes a full-time job. And by definition, we don't have a job.
Sure. Great. I see Kidron has her hand up. Did you want to respond to this, Kidron?
Yeah, I just want to make sure that the folks on the call, I first of all, I completely hear you that we need to look at this from the scope of, accessibility, and any potential conflict of a case management agency receiving those complaints for those things that you bring up. So we hear you loud and clear that we need to address that to the best of our abilities within rules at a high level. And then, just so everyone on the call is really familiar with our, current process, I want to make sure that you all hear loud and clear that we have an escalation form. It's a really simple Google form that you can fill out: first name, last name, email address, person's Medicaid number, and a general, here's the issue that you're dealing with. If you have tried the avenues of the local case management agency and haven't got a response or a resolution, our team is 100% on board through that form to be available to folks that have case management agency complaints. So we'll pop that in the chat again, just for you all to know that that's our current process. Because what I'm hearing is that, this is something we need to consider in the future, but I want to make sure folks on the call also have a current way to reach the department when they're not getting resolution to their concerns. So please know that we'll pop that in the chat. Thank you, Tiffany. Please do that. And then we are glad to take those complaints as we, continue to look at rules in future. I want to make sure folks on the call have that resource now.
And thank you for that. Might I suggest moving forward, we actually require that any service or contractor be required to put the way to escalate something on their landing page as sort of a, hey, if we can't resolve this, this is where you go. That actually be a requirement.
Thank you for that feedback. I think that that's a really good suggestion, and we can look at the possibility of adding that to the contractual requirements of our partners. Thank you.
Thank you, Mary Michael and Kidron. So this is John. I just want to point out, I see a couple of comments in the chat. Again, if you want to have us respond during this meeting, just type your name for the queue. Otherwise, we will record those for our log. Having said that, we'll move on to Christy. Go ahead, please.
Sorry, it took me a second to find my mouse.
Okay.
So my comment is under the responsibilities piece, and I think it mirrors something Liz Parr put into the chat about a responsibility for the people we support and their authorized representatives to cooperate, not just in the determination of financial eligibility, but in all other areas where we have responsibility. So for monitoring visits, for participating in whatever grievance or complaint process we may have. And I thought there was some language in 8.390 at some point about people's responsibility to respond to agency communication in a timely manner. So that's something that I'd like to see, some language about certainly the people we support have the right to expect us to provide timely notification, cooperation. I think we need to ensure that the people we support are responsible to be responsive as well.
Great. Thank you for that suggestion. Much appreciated. I think what you're asking for is full transparency of all the responsibilities that a client and member or guardian has to be involved in HCBS programs.
Yes, and to put and to ensure that there's some clarity in what those expectations are. So when we're making phone calls as either a case management agency or a provider agency to accomplish a task, a monitoring visit, and we don't get return phone calls, or we don't get cooperation, it makes it very difficult for us to carry out those responsibilities.
Sure. Yeah, fair enough. Great. Thank you for that suggestion. I appreciate it.
Thank you, Christy. We will move on to Alicia.
Hello, can you hear me okay?
Yeah.
Great. This was actually the question I had my hand raised for earlier, but I didn't know if we'd get to it further down.
Sure.
I know over this past year, we talked about implementing, excuse me, an HRC, a Human Rights Committee, to involve the single entry point or non-IDD individuals. Is that something that we are looking at here as well? Because that sounds like the conversation.
It is not something we're looking at. So that will
Okay.
be part of, Human Rights Committee will be a part of the Case Management Agency responsibilities and requirements. Excuse me. But that will continue to be just for IDD waivers at this point. The department continues to do stakeholder engagement about Human Rights Committee and that process. But
I'm just kind of jumping the gun here.
It's okay. That's all right.
Okay.
It's a great question. And you'll see, I think HRC is Human Rights Committee is referenced later in the document that we'll address with rights modification. So I think that's a great precursor to that. Yeah, Human Rights Committee will be just for IDD folks at this point. We have done a ton of stakeholder engagement over the last, gosh, I know Trisha is on the call, but I would say maybe 4 years, and getting consensus about who to include and exclude from that has proven challenging. And so we are sticking with what we have. We have some universal documents that will be required to create some consistency for folks. But that doesn't mean that there won't be iterations in the future. This is just for our current rules, current case management agency requirements, as will be reflected in the contracts for 23, 24, and the coming years on those contracts. Is that helpful?
Very much so. Thank you, Tiffany.
Okay. Yeah, thanks.
Thank you. Nancy Vigil, you're up next.
Thanks, John. Tiffany, on bullet A4, where it says notify the case manager within 30 days after, kind of going back to what Mary was hitting on, I think that notification needs to be a little bit more quicker, just so that we can appropriately provide services and supports to the client or member, because we know that if they wait 30 days after being placed into a nursing facility or ICF-IID, that there's going to be some billing issues and then it just kind of compounds issues. If they wait 30 days after, we're going to scramble. There might be some services and supports that need to be implemented right away, or at least some referrals to other community resources. So I don't know if you've all thought about that, or if you could change that language so that we get the members' needs documented and fixed quicker.
What is your suggestion?
Notify the case manager within like a week.
Okay.
If not sooner. I mean, because I think it's really important that we address the members' needs immediately. And it's kind of hard to do it 30 days after the fact.
Okay. Thanks for that suggestion. I'm happy to take that back and to take feedback from others in this room about that suggestion. Thanks, Nancy.
Thank you. Rendy, you're up next.
That was a perfect segue for me. Thank you. Wow, 7 days. So I'm a parent. And I'm just looking at this thinking, we just keep getting more added. we're not paid for this. Half of us are not, right? I think of my mom who, sorry, I'm going to get emotional, 65 years old, raising an autistic teenager and taking care of a dying 40-year-old man with ALS. She can't do all of this. How are we supposed to do this? And then we're balancing school, right? And their IEPs. And I mean, we have so much on our plate as family caregivers or even just family members, right? That the responsible person, 7 days, we're not even thinking about this in many of these situations, to be honest. We are just trying to survive and tread water. 30 days, I agree, might be too much, but I also think you need to break this up. Like, my daughter could have a medical condition change literally weekly, right? Or her behavioral condition. So I definitely see like placement, emergency room admission. That is completely different than a change in a medical condition, because what does that mean, right? Like, I just think this needs to be broken up. And the expectations, like, I would read this also being a person with autism and think I need to report every little thing to the case manager, and that would overwhelm me. Every time there's an issue that comes up and I have to take my daughter to the doctor, do I need to report it? That's the first thing that came to my mind when I read the subsection A. But I think that everyone needs to be, understand and consider what, not just an individual if they're responsible for their own care, but those of us that are responsible for ourselves and many other people, whether it's a member or the member's children or their parents, there's just so much involved that we just keep getting expectations piled on us, same as the case managers do. No, I mean, we get that. But again, many of us are not paid to do all of this, and we're case managers. I literally coordinate and manage every aspect. So I would please ask that HICBUF consider that when you create rules, because honestly, the more I delve into my daughter becoming an adult, I don't even want her to be on any of these waivers, because I'm just worried it's going to stress her out trying to do half of the stuff that she's expected to do. So please think about the people. I know it's coming from a good place and because of problems, but just because there's a problem with one, please don't compound that for all.
Sure. Thanks for that, Rendy. I appreciate it.
Thanks. Elsa, you're up next.
Hi, and thanks. And I guess I have this section. To me, I feel it should describe a partnership between people, because what you're saying, you're imposing rules here on people and their family members that, and one, I don't know what if someone doesn't do this? What is it that you're actually going to do if they're not able to do this? Because that's a huge worry for me, is, oh, what if I'm not able to do this? I think also thinking about language, in number one, you use the word accurate. I think you just want comprehensive, information about a person's ability to do these things. There's kind of an assumption of inaccuracy because what you've used is the opposing word accurate, what's been used here. And then I also think the word cooperate, the opposite of that is not cooperate. And I just see so many people where they are not able to participate in this because it's not an accommodation. So I think thinking about what other words could you use? How could you describe this relationship so that it feels more like a partnership, we're in this together rather than you must notify the case manager. And I think there's that word notify again, which I think you quite wisely removed from another section. So I think, looking at all of these words, and then what is actually doable, as Rendy said, I would look at this and think, I have to do all of that. And then I'm not even sure what's going to happen if I don't, and how bad that will be. So there's those, so they come across as like, it's a bit threatening when it's a rule.
Thanks for that, Elsa. one of the things I didn't mention that your comment made me think of is that this is in the context of case management rules, case management agency responsibilities and requirements, and case manager requirements and responsibilities. And so what I hear you saying is that you want to see more of that kind of give and take in that relationship between the case manager and the client, not just this is the client's responsibilities. Today, we're just looking at the client responsibilities. In the next meetings that we have, we will be looking at case management agency responsibility and requirements and case manager responsibility and requirements. As it relates to these things, we just want to make sure that we're capturing what needs to be captured in this space. Those requirements for case managers are absolutely essential. I totally agree with you, and we have to make those things connect, I think is what you're saying.
Hey, Tiffany, this is Trisha.
Hey, Trisha.
And thank you for saying that. We really are, as the, excuse me, critical incident report policy folks over here, we really are trying to make sure that we are striking this balance of health and safety and making sure that our members are cared for in a manner that is best for them and their welfare. And we're really not trying to be burdensome to family members, but at the same time, we really do have to strike that chord where health and safety is most important. And so I know that it can feel a little maybe burdensome, but we really are trying to do that.
Elsa, is there anything else you wanted to add?
No, I'll lower my hand. I do think just looking at the language used, because I think it, I think there is an opportunity to address some of the language, like the word notify that you have already said is just a little difficult for people who are struggling. So yeah, thinking it through.
Okay. And please correct me if I'm saying your name wrong, Alyssa. I would be happy if you would send me an email or anything about that to kind of express your needs there surrounding that so that we can look into that further.
Let me just pop that in the chat. Thanks, Trisha.
That would be great. Thank you.
Okay, thank you, Elsa. Mary Michael, you're up next.
Thank you. So to those of us who are our clients and members, I wanted to reassure us and to let you know, basically what these rules are saying, and someone can correct me if I'm wrong, is it's saying that if something really serious happens, like we end up in the ER, or all of a sudden, maybe we fall, and so we need greater support at home, or we're supposed to be getting food support, and our helper isn't making our food, we need to let our case manager know. That's the gist of what these are saying. And they're spelling it out on behalf of the case managers. But I want to bring to HCPF's attention, we heard from the case managers, we end up scrambling. And we heard from those receiving the benefits, oh my God. I want to point out to you that this is the current relationship that many of us have. The case managers are looking at this as a job, and those of us who are receiving benefits are looking at this as literally life-saving interventions. So to put on those of us who are trying to save our lives or the lives of those we're caring for, that we have to report something within 30 days so that somebody doesn't have to scramble, there's a problem there with mentality. And I think a lot of us would like to address that. My suggestion in this specific instance would be to say to someone, as soon as possible, to report these as soon as possible, to increase the likelihood of seamless support services, and then say, but within 90 days or within 30 days. We just have to be realistic. But what you're hearing is you're hearing a fundamental problem. And it's something that we're going to need to look at changing as we move forward.
Thanks for that, Mary Michael. I think that's a really great suggestion. I think from a kind of billing and back end perspective, I think that's the concern, partially for HCPF and partially for case management agencies, is that if like you said, if support needs to be increased, if something is not happening and someone is billing for a service that they're not providing, the case manager needs that information to help support. And what I'm hearing from members and clients and individuals is that, gosh, that is really overwhelming to remember to do to notify about all of these things. So I appreciate that suggestion. We will put that in the log and take that back for consideration.
Are you hearing the fundamental difference between people who are really viewing this program as a job, which makes sense, but then that this program is so essential to those of us receiving it, and it seems that something is lost in translation between those two groups?
Do you have a suggestion related to the rules on how to fix for that?
I think some of it's going to be language, and I'll think about this a little bit more. I'm working with CCDC, so you'll see a lot of me on this, and I'll get back to you as we come up with some more things.
Okay, that sounds great. Thank you.
Thanks, Mary Michael. Jose, you're up next.
Thank you, John. I'm going to say something, and usually I don't say things like this. So Elsa and Randy, especially, I ask you to please understand where I'm coming from. But partially what HCPF is saying right now is correct. We have fought really hard to make the department be more responsive to our needs, to make CMA agencies more responsive to our needs. That means that us as clients, whether it's through our ARs, our case managers, our parents, our attendants, whatever the scenario may be, we do need to be responsible as well. So I get what you guys are saying. I do. Believe me when I say that often I do fail to be responsible for my own case, in the sense that I'm really good at caring for my, I didn't mean responsible, I said responsive. Randy, just to clarify. I'm really good at following up with my clients. I'm really good at following up with my cases. But when it comes to myself, I neglect. And it's due to my nature. It's my nature is I'm the caregiver. I'm the advocate. But at the same time, that means that as a responsive and responsible client, I often rely on Donna or Julie to help me with those things. I call them and I tell them, this has changed. I need help ASAP. And they help me with my personal stuff. And I'm saying this fully transparently. You guys know that I often am on the opposite side of HCPF, and that I often am very competitive with HICPA, but at the same time, I try to strike a balance between what we have asked them to be and to do, and what we have asked ourselves and put ourselves on. And of course, there is a difference clearly between a client who has a developmental disability and a client who does not.
Sure.
I myself, I am a CDAS client, which means that I'm putting a lot of responsibility on myself. So when I'm saying this, I'm trying to be very careful about it because I don't want to offend anyone. And I completely understand and agree to a certain degree that these responsibilities, rules can be a little bit intimidating and also hard to comply with. But at the same time, as clients of a community program, HCBS, that's why it's HCBS, we do have certain obligations and responsibilities that we need to comply with. And whether that is ourselves, like I said earlier, or with an AR or an assistant or something like that, which is also our responsibility, again, the word, sorry, to seek out those kind of helps. We need to use them appropriately.
Yeah, I appreciate that, Jose. I think, yeah, point well taken. There is a, you know, like Elsa said, there is a cooperative relationship that happens for these services. So thank you for your comment. I really appreciate it. I think I want to do a time check. We do have 2 more sections to get through. So I think we have time for one more comment on this section. Sorry, I see a couple more hands. If you could put your comments or questions in the chat, and then we will make sure to record those. But we have time for one more hand.
Tiffany, this is John. I think Liz has not spoken out loud yet, and she is first in the queue. So Liz, go ahead.
Hi, thank you. I just had maybe, I mean, this is a complex issue, but maybe to help with clarity in number 4 is, yeah, what really case managers need to know is if there is a significant change that would impact their need for services and supports or waiver services. Not every change in diagnosis. So it's more, if we could find language to clarify that so that then we know that the person might need additional things, and that part of it might be that somebody has a significant, never had medical issues, and now they do, and they may not know that long-term home health is available to them or other types of services. And so maybe changing the language to say, this is why, under these circumstances, to report that so that we can help work through that, what may or may not be available. The sooner the better, so that they can get in place. And then maybe separate out the nursing home from the others because of the financial, that those are more critical due to overlap in services. So I just wanted to make that suggestion.
That's a great suggestion. Thanks, Liz. We will document that and make those accommodations if we can. Thank you, everyone, for your input on this section. We're going to move on to the use of a legally authorized representative. So persons who are eligible for services and supports, the parent or guardian of a minor or legal guardian of an adult shall be informed at the time of enrollment and at each annual review of the individualized plan. They may designate an authorized representative. The designation of an authorized representative must occur with informed consent of the person receiving services or the parent or guardian of a minor or legal guardian of an adult. Such designation shall be in writing and specify the extent of the authorized representative's involvement in assisting the person receiving services in acquiring or utilizing services or supports available pursuant to statute section 25.5-10 and in protecting their rights. Letter C, the written designation of an authorized representative shall be maintained in the record of the person receiving services. And D, the person receiving services may withdraw their designation of an authorized representative at any time. Any comments, questions, or additions, changes that you'd like to see for the section of use of an authorized representative?
Thanks. So this is John Berry. We are taking names for the queue now for this new section. Jesse, you had your hand up earlier. I'm not sure if that's for this new area. Amanda, have your name down. Liz, thank you. Anyone else for the queue?
Hi, John. Yeah, my comment is for the previous. I think that
Okay.
I put a comment, if I can, just real quick. I put a comment.
Well, we do need
to, you know, I've worked.
We need to move forward to the next section, and our time is rapidly running. So if we may ask you to put it into the chat, I would really appreciate it. Thank you so much, and apologies for that. Amanda?
Yeah, I just noted that I'm sorry, for the authorized representative, you say the person, a guardian or of a minor child or a legal guardian of an adult can create or authorize and author, that doesn't make sense. You know what I mean?
Yeah.
But it doesn't say that all three of those can disengage with the authorized representative. It only lists the person. So maybe consistency in that language.
Great. Thank you for that call out.
Thank you, Amanda. Liz, you're up next.
Yeah, I don't know if this is even possible because it might be more legal terminology, but it gets confusing because there's an authorized representative in CDOTS and then there's an authorized representative in this. And if there's any way we could find different terminology for one of those, that would be helpful.
You know, the team that has been working on these rules actually said the exact same thing, which is, I believe, part of why the word legally authorized representative is added in there. But I will definitely take that back to the team and we can discuss. People are welcome to put in the chat any other suggestions for language regarding an authorized representative in this regard. So we're open to that feedback. Thank you. Other questions or comments about legally authorized representative? Okay, we will move on to rights modifications. In this section, you'll notice there is quite a bit of red strikeouts and green. Just a reminder that the green is updated language that maybe was outdated, and the red strike through is things that are outdated and being removed. So 8.7210.4, member rights modifications, letter A. In green, every rights modification affecting a member shall be consistent with 8.484 and the following additional requirements. Letter B, rights of a person receiving services may be modified only in a manner which will promote the least restriction on the person's rights and in accordance with rules herein or by a court order. Again, like Leah mentioned, you'll notice that suspended has been struck out and modified has replaced that language. Letter C, when a rights modification is proposed, it is reviewed by the individual, their guardian, or other legally authorized representative and the rest of the member identified team. And if consented to, suspend is granted. It is documented in the person-centered support plan. And then you'll see the struck out language of individualized plan and what needs to be included in the individualized plan. I believe that this is referenced in the case management section, not referenced. This is fleshed out in the case management section because that's the case manager responsibility to flesh that out in the person-centered support plan. Letter D, when a right has been modified, the continuing need for such modification shall be reviewed by the individual's interdisciplinary team. That language needs to be updated to reflect the above changes, just a note to our team. As led by the individual or their guardian or other legally authorized representative at a frequency decided by the team, but not less than every 6 months. Letter D1, such review shall include the original reason for modification, current circumstances, success or failure of programmatic intervention, and the need for continued modification. Number 2, restoration of affected rights shall occur as soon as circumstances justify. And number 3, at the time a right is modified, such action shall be referred to the Human Rights Committee for review and recommendation. Such review shall include an opportunity for the person who is affected, parent of a minor, guardian or authorized representative, after being given reasonable notice of the meeting, to present relevant information to the Human Rights Committee. Letter E was struck out because it was emergency action, and that all falls under rights modifications now. And that is the end. I will make mention that I think we missed in our review needing to reference that the Human Rights Committee is just for people with intellectual and developmental disabilities. So we will make that note. Any other questions, comments, feedback, or input about member rights modifications?
This is John. So if you do have a question or comment, you can type your name in the chat. Nancy, thank you. We'll get to you. You can raise your hand in the webinar, or you can unmute your phone if you're on the phone only. Give me your name, *6. Okay, I'll be monitoring for hands raised. Nancy, please go ahead.
Thanks, John. Tiffany, somewhere I saw it has to be reviewed by the person's interdisciplinary team. And I just have a question, I think, because currently in the SEP waivers, which I know this is going to be a case management agency, will those non-IDD waivers be required to have an interdisciplinary team?
No, and we're actually changing the language of interdisciplinary team to member identified team. Here, I just highlighted this, the strikeouts that are happening. And then, yeah, and then that needs to be changed and reflected here in letter D, which we missed that in the review. So it will be updated to member identified team. Interdisciplinary team will be used specifically for regional centers, but not necessarily for other waivers or for waiver programs.
Okay, thanks, Tiffany.
Mm-hmm.
Any other comments or questions at this point for Tiffany regarding this current piece? You can raise your hand in the webinar. You can type your name in the chat. Again, we're seeing comments in the chat, but unless people specifically ask to be put in the queue, we will record those for the listening log. Okay, Rendy, please go ahead.
Can you define what member identified team is? Like who has to be on that team other than the member? I'm just curious.
Yeah, great question. It will be in our definitions section. I don't know if there's a case management staff person who wants to speak to this, but my understanding is that this is HICPUF's attempt at that person-centered language, that members can identify who they want on their team to do these types of review. Making sure that it is people who are directly related to or might need to know about these types of modifications, and excluding people who might not need to know that, where right now the interdisciplinary team is kind of everyone that's involved with the whole person's services. Again, their massage therapist might not need to know about those modifications. So I believe that's the intent of that language.
Thanks, Randy. Any other names for the queue? Comments, questions for the queue? You can type your name in the chat or raise your hand in the webinar. Like we don't have any more for right now, Tiffany.
Okay. Well, this is all we have for today. I will stop my share here. So thank you all for being here. We really appreciate it. We are working on our next sections, and I will mention that there will be some changes to the schedule coming up with the CCM going live, the care and case management system going live here in March. We have trainings going on this month and next month. And then like I said, the go live in March. And so we're needing to make some adjustments to this schedule to make sure that we have staff available to answer questions, to flesh out answers to your questions after the meeting. So please pay attention to our website and to John's emails going out. We also have a list of previous attendees that we will email with those updates. But I wanted to tell you all up front here that we are going to have some changes, and we would love for you to continue to attend. These have been really great and really, really helpful for us as the department as we're creating these rules to understand what is happening on the ground, what is needed to clarify language and expectations, and that kind of thing. So appreciate your patience with us. Thank you for being here and for your input. So with that, John, do you have any closing remarks?
Tiffany, the only thing I would just point our attention to for a quick second is Kelly's question just now in the chat, which I think is great. Can you please put the Zoom link on the HICPUF page? So we do have the Case Management Redesign page. I wanted to point that out, and I think that's where it is, Tiffany, but I don't want to misspeak. So is that correct? All these meetings.
It looks like under meeting topics, it references the OCL stakeholder engagement page for the meeting and for the most up-to-date meeting information. And Kelly, the reason that we do that is that calendar is really where we update meeting information, and we want to make sure that it is updated in a timely manner. And so if we have it in multiple places, it might not get updated at the same time. So if you click on that link to the OCL stakeholder engagement page, that will be the most up-to-date information on the meetings, this meeting coming up, but also all the meetings that OCL is doing. And I can actually drop that into the chat for people to just bookmark.
Just did, Tiffany.
Oh, great.
OCL-stakeholder-engagement page, and it's really a good page to bookmark or add to your favorites. we do keep it updated pretty darn well. So it's a great resource.
Oh, Brendy, I see your hand.
Yeah, sorry. This not being able to use the chat for questions is really difficult. I just want to point that out for those of us that might struggle with verbal communication. I'm struggling with processing that timeline that you all have published out on the CMA redesign. It's kind of hard to follow for some of us, and so I'm just wanting like what's the date for this new, what families are all being told about, the person-centered plan that's going to be implemented in the new LOC. Like, what's the date for that? I know it had been piloted for a while, but do we have a date of when the case management agencies will start using this?
I don't have that date. I see that Kidron is still on. Kidron, wondering if you have an exact date on that.
Thanks, Tiffany. I do not have an exact date as of right now. We would have to take that back and communicate that out.
Okay.
A month? Do you have a month? Like, is it coming soon, like in the next month or so? Is it 6 months out still? Because I know things keep getting bumped.
Yeah. So my understanding is, and somebody can kick me under the table if I'm wrong, my understanding is that the department is launching the care and case management system with the current assessment, and then in the coming months, like I'm not gonna, don't quote me on this, but after the CCM has been implemented for all case management agencies, then the team will start looking at using the new assessment. So Randy, we have put this in the queue for either for one of our logs. We'll make sure to get some clarity on that timeline for you. You're welcome. And I do apologize again for our short-staffedness today. Like I said, my teammate Nicolette is out sick today. So managing all the screens and the sharing and the chat has been a challenge. So appreciate your patience with us, and hopefully we will be all back in action next time we meet. So thank you all for being here. We will see you next time.